I want to demonstrate how to place and position the mass traction belts. First, what you want to do is just place them on the table, at the break in the table. A slight amount of overlap is okay at this point. So as the traction pulls, they will separate. We want to have our wide piece of webbing here extending off the bottom part of the harness here. On the top piece of the harness, we have a attachment strap here. Secure it in place. This is just going to go, you're going to take this and just place it through the face hole and then clip it in place. And then you can adjust this length of it and also position of it so that you have the piece of padding here positioned over the edge of the table so that it won't cause any damage to the table. These belts, you want to position them with the surface that has all of the entire clean surface here that has the sticky rubberized surface facing upwards. This also is very convenient for cleaning, just to spray off and wipe down. And it does have two side pieces that come off the lower belt that you can also position just kind of laying in place there off the side. Okay, you can go ahead and have our patient come up here. Okay. Looks pretty good. I'm going to go ahead and secure the top piece here first, and we're going to bring that up on each side. When securing the top piece, we're going to want to use a crisscross pattern. So I'm going to take the lower piece of webbing on this side of the belt, and I'm going to take and thread it through this barrel adjuster, the top one on the other side. So I'm going to take this and I'm going to position the webbing and bring it underneath the barrel, then bring it back over the top of the barrel, and then snug. And then I want to leave the tab out of my way here, so that when I take this other piece that's going to be the top piece of webbing on this side, I'm going to take that through the barrel adjuster again, underneath the barrel first, and then back over the top of the barrel, and I can secure that. And then I've got a nice crisscross pattern, and it catches underneath the ribs, the angle of the ribs. Now I'm going to attach the lower belt. I'm going to bring that right across the iliac crest, just at and underneath the iliac crest. And I'm going to go ahead and position this piece of webbing again underneath the barrel. And then we're going to go over the top of the barrel. And we're going to snug that quite securely and firmly. Now we're going to take our two side pieces that are coming off the lower belt and just position them over the top of the thigh. The padding is movable, so it can go over the top of the thigh to protect the thigh from any pressure. We're going to grab our lower piece of webbing, and we are going to take the secured the D-ring that's on the end of the webbing, and we're going to take our J-hooks, snap J-hooks off the side straps, and snap those onto that with the J-hook facing up. And now we are snapped in place there. Finally, what we'll do is take the sliding D-ring that's remaining in place here, and we'll attach that to our clip that is going to the rope that is going to the traction unit. And we can take up our slack. Then if we need to, we can position the patient's legs in a flex position or up on a stool if needed, and then begin our traction procedure. One of the nice features of this traction belt system is how easy it is to loosen the belts as well. In order to loosen the belts once they've been secured, is simply lift up on the orange tabs, and that will loosen the belt to give you some slack. Once you've got those loosened, you're just going to unthread the webbing, like so. Once it's loosened, just unthread the webbing. And now you've got it released.